Hi, Dominique.
Hello.
How are you doing?
I'm good. How are
Do you
you?
remember me from earlier?
Yeah.
Oh yeah, my name is Ed. In case you forgot, I'm gonna be your nurse today. And then good news, I'm gonna be discharging you today.
Oh,
Are
good.
you excited to
Good.
go
Yes, I
home?
can't wait.
Okay. Well, the first things first is this is gonna be short. It's not gonna take like probably 10-15 minutes of your time. Is that okay?
Yeah, that's fine.
I'm just gonna, before I let you go, I'm gonna go through a lot of your discharge instructions from your doctor, just to make sure we continue your care and make sure you feel better all the way until you go to a place where you're going.
Okay.
Okay, and I just would like to let you know that from here you're actually going straight to a facility. It's an assisted living facility.
Oh, okay.
Okay, it's right here in Monster. It's actually called Community Healthcare Rehab and Assisted Living Community. Have you heard about that?
Yeah, I
You
have
did?
some friends who go there.
I was
or
able
they
to
live
talk
there.
to, oh good. I was able to talk to your niece, and she actually was the one who found the facility because she was so concerned about you and her aunt and her uncle, because I've heard that you are taking care of your husband, so because he has dementia. So she found a place, an assisted living, that both of you are going.
Okay.
That sounds good.
Mhm.
Okay, that's good. All right. Oh, your alarm is actually on too.
Oh, yeah.
Are you waiting for a call or something?
I'm not sure what that was for.
Oh, okay. It's alright. Alright, can we go through?
Yeah,
Okay.
sorry.
So we start off with your diet. So your doctor still put you on a cardiac diet.
Okay.
So um, with your cardiac diet, it's because you're taking hypertension pill and you have some cardiac issues before. So he had put you on a cardiac diet that's low salt. We want to make sure you drink plenty of fluids. Actually, it's not a lot of a difference because when you came in here in the hospital 15 days ago, you've been on cardiac diet.
Mhm.
So how did you feel about that? Like, what's the
Eh,
food taste like?
I can't eat everything I want, but I know it's for the best.
Oh yeah, it's for the best for you, and so you can also take good care of your husband, and
Yeah.
help you guys live longer and enjoy life. He also suggested that you eat small meals instead of one big one, and you keep your body weight, keep it at a good weight. Okay,
Okay.
and eat a lot of fruits, vegetables, whole grains, and pasta. Is that okay?
Oh yeah, I love pasta.
Okay, very good. So you came in here with exacerbation of your COPD as well. So we want to make sure you also eat a diet that's high in fiber. That's just gonna help you, help breathe better and everything.
Okay.
As you've seen, when you came in here, you were put on oxygen. But for the past 24 hours, based on your vital signs, you actually don't need oxygen anymore. So you're not gonna be taking oxygen with you when you go to the facility,
Oh,
and
good.
hopefully you can tolerate it, as long as you can, and we don't need it for the meantime or in the future. If it does, you can always call your doctor for that. Okay. All right. Did you have any questions so far? So we've assigned you with a social worker. Her name is Beth. She's very good, and she's been working in the hospital for like more than 10 years
Oh
now.
yeah, I think I met her. She
Oh, you
came in
did?
and talked to me
Oh
earlier
yeah, that's
today.
good. And I also have mentioned to her about the condition of your husband, and you're worried about taking care of him, him being having the dementia, and you were the one who was taking care of him.
Yeah.
So I told Beth about that, and she's gonna take care of it, and relay the message to the facility and make sure your wife will get a good care in the facility that you're going. Don't worry about it. This facility has a very good review, and I've heard about it. It's a very nice facility to live in.
Okay.
Okay, and also she has arranged a transportation for you to go to the facility, and also your niece is gonna take your husband to the facility as well, so you guys will
Okay.
be there.
Good. So we get to be together still.
Right, awesome. In case you have to, obviously you're gonna be seeing your doctors for follow-up visit. The facility will help you with your transportation as well. Okay. Um, The doctor's visit is one of the things that we're going to be talking about in a little later, okay?
Okay.
All right. Um, we're going to go through your medication. There's not a lot of change in your medication actually. What you've been taking at home before coming in here and what you've given here, you will be taking them when you go to the facility. The same dosage, the same, number of, I mean, the same times in a day and how many times in a day, okay? I just want to go quickly all those medications for you.
Okay.
So you have the fluticasone or salmeterol, the discus inhaler, and I've seen you use it. You still remember how to use
Yeah.
it? Yeah, that's for your COPD. That's to lessen the wheezing and your trouble breathing. Okay.
Okay.
And one thing that you have to keep an eye if you develop rash or itching or swelling or any other like adverse reaction like chest pain and irregular heartbeat, you want to make sure you call your doctor right away. Okay.
Okay.
All right. You have albuterol. This is for like sudden onset of shortness of breath. If you feel like you're starting to feel like shortness of breath, then you use your albuterol inhaler.
Okay.
Do you remember how many puffs you have to take for your albuterol?
2.
2 puffs.
Two.
Very good. And you know how to use it still, right?
Yeah.
Yeah, that's only if you feel like you're starting to get shortness of breath. Okay? You don't take it every day really. If you don't have shortness of breath.
Just when I really need it. Okay.
Exactly. And then the one thing you want to keep an eye of is chest pain again, irregular heartbeat, or if you feel like your heart is racing too fast. So you want to make sure you call your doctor right away, or you feel nervous or severe headache or shaking, you can control it. Make sure because you're in the facility, you inform your nurse or whoever's taking care of you there, or your LPN or your nurse, and then or your aide, so they can coordinate with your doctor. Okay.
Okay.
All right. Your third medication will be prednisone. This is the steroid that we've given you here while you're in the hospital. This also helps in your breathing problems. This expands like the lobes in your lungs, so you feel you don't have shortness of breath. You breathe better. You feel better. Okay. You want to make sure you call your doctor if you experience muscle pains and if you feel like cramps that doesn't go away. Okay. And if you feel like you have loss of appetite, heartburn, and etc. So you tell your nurse in the facility so they can contact your doctor right away. Now the fourth one will be Montelukast. If you see a lot of these medications as your for your COPD.
Okay.
Okay, Montelukast, it controls and prevents the symptoms of your asthma or your breathing problems such as your COPD. Okay, so there's not a lot of serious allergic reaction to it since you don't have any allergy, so you don't have to worry. But then serious adverse events are very rare, but you have to make sure you tell the nurse or whoever's taking care of you to tell the doctor that you're experiencing mood changes, numbness, tingling, or shooting pain, or even sinus pain or swelling. Okay? Or even uncontrolled muscle movement. Okay? Then, of course, your lisinopril. This is your antihypertensive drug. I know you have been taking this for a while. How long have you been hypertensive?
Maybe 10 years.
There you go.
Yeah.
Yeah, you've been taking this for a while. This is to help you manage your blood pressure. So you still have to take it. Your lisinopril daily in the morning with or without food. Okay? And so as with your metoprolol as well.
Okay.
Your metoprolol is another antihypertensive drug that you can take along with your lisinopril in the morning with or without food.
Okay.
Yeah, I'm sure the nurse will give you your medication when you're in the facility. Just to want to make sure, in case that you can always tell them in case they get busy and they forgot about it. Okay, and then tell them if you have signs of adverse event of this drug, the lisinopril. If you have like stomach pain that's too hard to handle, nausea and vomiting that doesn't stop, make sure you tell them. Okay.
Okay.
For your metoprolol, if you feel like you feel so weak, and you feel like you're fainting, you have severe dizziness, those are signs that serious side effects of metropolol. So you want to make sure you tell your nurse right away,
Okay.
or whoever is in the facility. You also are taking aspirin, okay?
Yeah.
So this is for your mild to moderate pain, and also a blood thinner because
Yeah.
you've been hypertensive for a while. So it also acts as a blood thinner. So you want to make sure you keep an eye if you have any bruises you see in your body. Okay, you want to make sure you report that right away to your nurse. I'm sure they're gonna be assessing you every day, so they're gonna see it. But if you see it and they don't, let them know. Okay.
Okay.
You only take it once a day in the morning, preferably with full glass of water, or if possible, if it's either with or without food, but if possible, if you can take it with one glass of water, that would be good.
Okay.
Okay. And the last but not the least is your rosuvastatin. It's actually a statin to lower your cholesterol. Yeah, it's the one. It's called Crestor.
Okay.
Okay. Yeah, that helps lower down your cholesterol. You take it in the evening with meal. Okay. And you tell the nurse right away if you see like your urine is getting to be starting to be foamy, or you develop like muscle pains. You see like your skin is starting to get yellow, so that's a sign that your liver is being damaged by the medicine. So you want to make sure you tell them right away, so immediate help will be given to you. Okay.
Okay.
All right. Now I'm gonna have to go over real quick to your um, CATS index survey that we did for you. So this is actually an indicator. This was actually like a survey that we did while you were here to see how we assess how your mobility, your how you do your daily activities like showering, bathing, eating, walking, and moving. We assess you for that, and we give you some scores to see if you're independent or you need help with anything at home. But it looks like you get a very good grade with a
good.
total number of 6, and that's the highest you can get. That means you are still like pretty much independent in everything, like
Okay.
bathing yourself, putting on some clothes, going to the toilet, um, moving in and out of bed, or going to the chair, exercising, do some, if you can tolerate a little exercise or stretching, that would be nice. And then, of course, getting food and eating. So you had a pretty good score for that. So we want to make sure we give this CATS results to your facility as well,
Okay.
because they mentioned that they're gonna do a thorough assessment when you get there.
Okay.
I think it's you and your wife as well. Okay. And the last thing that we're gonna go through would be it's very important, your follow up with your doctor. Okay. So the doctor ordered to see you in a couple of days. So Dr. Schofield, your pulmonary doctor, your lung doctor wants to see you like 3 weeks from now. He wants to assess how well you did with your COPD. Okay, this guy is gonna be in Monster, in his office in Monster. But like I said, the facility will facilitate all your transportation to the clinic as well. And then you have to see your cardiologist also. Yep, a month from now. So yeah, he ordered to see you a month from now. So what is today? 7th of October. So maybe you can go there in November 7th or November 8th, whenever
Okay.
you're.
Will the facility help me schedule?
Oh yeah, they will.
Oh, okay.
They will help you schedule, and if you have like important schedule that you want to see your family or something, then you just let them know so they can move the schedule for
Okay.
you. Okay. And obviously your primary care physician wanted to see you too, like 2 weeks from now. That's gonna be 2 weeks from now. Then two Wednesdays from now.
Okay.
Okay. I believe that's gonna be 7,
The
14, the
21st?
20. Yeah, it looks like on the 21st. But it's all here.
Okay.
I'm gonna give it to you, and I'm also gonna give a copy to your niece because she mentioned that she's going back to the state where she lives. But I want to make sure she keeps an eye and contact with you guys. Okay, if you have
Okay.
any trouble or problem. I think that's it for now. Did you have any question? You
covered
sure?
everything. Yeah, that's good.
Okay, well, thank you very much. I'm
Thank
so glad
you.
to be of help while you were here. I hope you feel a lot better when you go to your facility and don't go back to the hospital yet, okay?
Oh no, I won't.
Okay,
I
very
won't.
good. All the best for you and your wife, okay?
Thank you.
And your husband, I mean. Thank you so much and have a good day.
Thank you.